My name is Munish Gupta. I'm an orthopedic spine surgeon at HSS. So I specialize in spinal deformity, which means scoliosis, kyphosis, all kinds of deformities of the spine where people are either bent forward or sideways, and it varies from age 2 to in their 80s. So I operate on the entire spectrum from young to old. Children are very different from adults because their spine is growing. But now we're lucky that we have instrumentation that grows with the child. So we have these magnetic actuators. So we put them in the spine, and then as they grow, the instrumentation grows with it. And when they're done growing, we can fuse their spine. So there's been a lot of advancement in spinal instrumentation. So we have to worry about, children having spine that's fused too early. So with these growing systems, we can grow the spine so their spine can grow to a normal size. My approach to patient care is very simple. I like to treat them as if they were a family member. So I want to be as gentle and as empathetic as possible, but also be very honest with what their condition is, what can be done about it, tell them the risks and benefits clearly so they can make an informed decision on which way they want to proceed. So when I see a successful patient, it's amazing, and all your hard work comes to fruition for the years and years and years of training, because you're taking a human being, taking their deformity, correcting them, and then they're happy about it. Because a lot of time they're in a lot of pain, or they have low self-esteem because of the deformity, and you're improving their life greatly. So you take a person who's in that situation, you improve their life, and sometimes in older people, they can't walk very far, and you fix their spine, you improve their stenosis, and they can walk better, they're going to live longer, and they're going to be living a more functional life. So the quality of life is improved greatly.